So with pregnancy, every woman from the point of conception throughout the entire pregnancy, as we're moving through time, insulin resistance goes just like this. So it gets progressively more dramatic and noticeable throughout the entire pregnancy. And a woman shouldn't attempt to stop it, because you are literally providing more nutrients. By mom becoming insulin resistant, her nutrient availability in her blood will be higher, maybe higher free fatty acids, maybe higher glucose levels. And that is feeding the fetus. That little baby is thriving in the midst of mom's nutrients, as mom's feeding the baby from her own nutrients. And the elevated insulin is facilitating the rapid growth of the placenta and the baby itself. So everything good is happening here in the case of mom becoming insulin resistant. It's a problem only in those women, increasingly common problem, where while she's insulin resistant, her glucose levels are now starting to get higher and higher. And now you're actually just developing gestational diabetes, which is essentially type 2 diabetes that's happening in pregnancy, where that is the woman's inherent or physiological insulin resistance now has stepped over into the pathological. Now she's hyperinsulinemic and hyperglycemic, and that is not as good. Mom will get much fatter than she would want usually, and the baby will be much bigger than mommy wants and parents, because if a baby is born to a gestational diabetic mother, that baby is much more likely to struggle with weight and diabetes issues later in life.
Wow. My mind's blown on that, because I had not realized that insulin resistance. So essentially what's going on here is insulin resistance is a way to partition nutrients to the baby and then also keep insulin levels a little bit more elevated to facilitate growth, which I had never thought about that. So you can't avoid insulin resistance during pregnancy, but what you can avoid is throwing the blood sugar spikes in with I think the way I had looked at it is that, blood sugar or gestational diabetes during pregnancy it occurs from a poor diet, that, you eat too many processed carbs, too many blood sugar spiking foods, and then that leads to an insulin resistance that causes gestational diabetes. I think I had always traditionally looked at it kind of similar to the way type 2 diabetes is. But in this case, it's the opposite. The insulin resistance is already there. So your job is then to make sure that you're not also having the state of hyperglycemia, like you were saying, having that blood sugar elevated all the time. Is that correct?
Yeah, that's right. Yeah, well said.